I have a personal passion for Hirschsprung disease and trying to understand how to better diagnose that. I've seen in my career so many misadventures that have to do with Hirschsprung disease and how that can affect a child later in life or even as an adult. What's really important is to also understand the underlying components and etiologies of those diseases and what the best treatment options might be for the patients that have Hirschsprung disease or anorectal malformations. If a child has been having issues stooling and has been needing help to go to the bathroom ever since they were a baby, that should be a red flag. Kids who have been on either rectal stimulations or suppositories all their life, that's another flag. They're at risk for a life-threatening infection called enterocolitis, and we call it Hirschsprung disease-associated enterocolitis. Those children and those babies need to be recognized right away and need to be referred to a provider that can treat them right away. Otherwise, not only will they have difficulty stooling, but again, they're at risk for enterocolitis, which is life-threatening. Within that, we do a lot of research here. We follow our patients from a clinical standpoint. We follow our outcomes. We compare them to national outcomes and are involved in a national consortium of colorectal centers so that we can pass information between us and them and really better understand this patient population in general. Anorectal malformations are a wide umbrella of different disorders where the anus or the rectum doesn't form in a normal, quote unquote, normal way. Those can be associated with genital urinary issues. One thing that I think providers, pediatricians can do, they're the first that really see these patients. And so if they do a physical exam and things don't look quite right, then they should feel comfortable to refer them and ask somebody to reassess that. What I think is most unique about our program is that it's truly multidisciplinary. We really have an excellent team of experts within their respective fields. I'm only one of a dozen or more different people. And so our nurse practitioners, our nurses, our dietitians, our social workers, we have a pediatric gastroenterologist that works with us full time. We have ability to do motility studies. All of those things put together really provide a comprehensive package for the patients, which is really, I think, unique in most settings.
If a child has Hirschsprung disease, they need a surgery to treat that condition. If that child has a surgery that is absolutely perfect, but their long-term follow-up and care isn't there, they may struggle with issues down the road like constipation, which may lead to soiling accidents, which can lead to issues with their mental health, maybe back from being bullied. Our program helps make sure that their operation was adequate. It works with the dietary team to make sure that child's getting enough fiber and water. We're working with our social work and our child life team to make sure that child has the coping skills that they need to cope with what they've just been through.
What we strive to do is have all the providers be in the same room together discussing every single patient every single time that they come so that we can then offer to the family and to the child a treatment that's really had the input of multiple different experts.
That's where we're able to get a need or a better understanding of their complex medical history, if there is any, and make sure that they're optimized for surgery. We have 100% board-certified pediatric anesthesiologists here at Shriners, and that's very important.
You need all of us to work together to really make sure that child is treated and gets through their issues.
Referring a patient to Shriners is as simple as a phone call, or if I know about a patient, I just email my staff and it gets done. They get seen as quickly as possible. Providing a procedure or surgical care or some sort of a treatment to them, there's no barrier to doing that.